We've all done it. You feel something weird, a headache, a tight chest, maybe your heart's racing, and what do? You Google it. Or now, you might even ask an AI chatbot, and within seconds, you're reading about anxiety, or maybe a heart attack, or a rare disease that affects 1 in 10 million people, but suddenly feels exactly like what you're going through. And just like that, you're spiraling. Sound familiar? Yeah, me too. But here's the question we need to ask. Should you self-diagnose using Google or AI? Let's talk about it, honestly, compassionately, and without judgment. Why we do it first, let's acknowledge why we self-diagnose in the first place. We want answers, we want relief, we want control. Doctors are expensive, appointments are hard to get. The healthcare system is often rushed, confusing, or intimidating. So we turn to what we know: Google, YouTube, Reddit, AI tools, and in some cases, this can be empowering. You learn, you feel seen, you take the first step toward help, but there's a line. And when we cross it, things can get risky. The good side of self-diagnosis. Let's be fair. There are benefits to online self-exploration. Increased awareness. You notice patterns in your thoughts or behavior that you never understood before, and suddenly they have a name. That can be powerful. Starting the conversation. Sometimes Googling your symptoms gives you the words to describe what you're feeling, so you can actually talk to a professional about it. Reducing shame. When you read that thousands of people also experience what you're going through, you realize, I'm not alone. That's healing in itself. Prompting action. You may be more likely to seek help once you realize something you thought was normal might actually be treatable. So yes, using the internet or AI as a first step can be helpful, but it should never be the last step. And here's why. The risks of self-diagnosing with Google or AI. 1. Misinformation and misinterpretation. The internet is full of information, but not all of it is correct, or current or context-specific. Symptoms overlap between conditions. Fatigue could mean depression, cancer, or just burnout. A racing heart could be anxiety or something else entirely. AI tools, even advanced ones, don't know your full story. They can't run tests, check your tone, or feel the nuance of what's happening inside you. And even if they give accurate info, you might misinterpret it. Reading a medical article doesn't make you a clinician, and neither does prompting an AI. 2. Health anxiety and cyberchondria. There's a term for this, cyberchondria, when Googling symptoms fuels anxiety rather than calming it. You read one post, then another, then another. Next thing you know, you're convinced you have a tumor, a heart condition, and a personality disorder, all before breakfast. And the more you search, the worse it gets. Because knowledge without context often leads to fear, not clarity. 3. False confidence or false panic. Sometimes self-diagnosis leads you to believe it's nothing serious when it actually is, or this is deadly when it's completely manageable. Both are dangerous. AI doesn't replace lab tests. Google can't assess your mental state. A subreddit isn't a medical license. Yet many people skip professional help because they think they figured it out online, and that false confidence can delay real treatment. 4. Mislabeling yourself. Let's talk about mental health. More and more people are saying things like, I have ADHD, I'm on the spectrum, I have bipolar disorder, I'm an empath with trauma. But many of these labels come from TikTok clips, quizzes, blog posts, not clinical evaluations. When you adopt a diagnosis too quickly, you may start limiting yourself. You may ignore the real root cause. You might shut down growth thinking this is just who I am. A real diagnosis is more than a list of symptoms. It's a whole person assessment. And sometimes what you think is one thing might be something else entirely. Can AI be a mental health tool? Now, with the rise of AI tools like chatbots and symptom checkers, people are relying on machines to help them understand their emotions and physical sensations. Can they help? Yes, to a point. AI can provide basic education, offer supportive language, help you reflect and organize your thoughts, recommend follow-up actions or questions to ask a provider, but AI cannot replace a diagnosis, a treatment plan, human empathy, personalized care, physical exams, nuanced clinical judgment. AI doesn't see your body language. It doesn't feel your pain. It can't detect subtle red flags in your voice or affect. It might be smart, but it's not a doctor. So, what's the best approach? Here's a better way to use online tools or AI for health. Start with curiosity, not certainty. Use the internet or AI to gather general knowledge, not to jump to conclusions. Write down what resonates. Track symptoms. Notice patterns. Make a list. This will help during your appointment with a real provider. Use reputable sources. Stick to trusted sites, Mayo Clinic, CDC, WHO, peer-reviewed journals, official health orgs, not random forums. Don't ignore red flags. If something is serious or persistent, don't wait. Talk to a professional, even if the AI said probably nothing. Bring it to your doctor or therapist. Say, I read this online and I'm wondering if it applies to me. This opens a conversation, not a self-declared diagnosis. Final thoughts. So, should you self-diagnose with Google or AI? Here's the honest answer. It's okay to explore. It's not okay to stop there. Your health, physical or mental, is too important to be left in the hands of algorithms and guesswork. Use Google as a flashlight, not a final answer. Use AI as a companion, not a clinician. And most importantly, trust your inner signal. If something doesn't feel right, get it checked out by someone who sees you, not just your symptoms. You deserve real answers. You deserve real care, not just search results.